So our next category is integrating care across boundaries. This category looks at developing multidisciplinary pathways, involving service users and carers, working across traditional boundaries and changing behaviours and reducing variation. And our finalists in this category are NEMO, Delayed Discharge Process, Belfast Trust, Reducing Out-of-Hours Stroke, DTN Times at the Ulster Hospital, South Eastern Trust, Nursing Home Dysphagia Service Redesign, Belfast Trust. And the winner is NEMO, Delayed Discharge Process, Belfast Trust. Congratulations to the team. And let's hear a little bit more about this award-winning project.
Hi, my name's Mary O'Brien and I'm the Divisional Social Worker in Mental Health and CAMHS. And I'm presenting today with my colleague, Niall Corrigan, Consultant Psychiatrist in the Inpatient Psychiatric Unit in Belfast. We're here to share our presentation today for the HSCQI 2021 Awards. We won, and we won in the category Integrating Care Across Boundaries. So we're going to share our project with you today. So our project was called the NEMO project, which means Needs Extra Management Option. And the project set out to create clear care pathways to improve patient flow and the journey of our patients through inpatients and back into community. So why did we set out to do this? Well, we had 17 people who were fit for discharge, who were subject to a delay in their discharge, effectively stuck in inpatients. So we wanted to improve the flow to get those individuals back into community where they needed to be, to free up the beds to have people come in who needed to be admitted, and to stop us having to use out-of-area admissions. What was our vision? So, as I said, our vision was to improve that flow, to set up a step-down unit, which is called Woodstock Bank. You'll see the lovely picture of it there, and I'm going to talk about that later. So that's what we wanted to do. We wanted to reduce the number of people who were delayed. And how did we do that? Well, we did it based on co-production. We worked with our service user consultant and our carers advocates and a range of multidisciplinary people and professionals to undertake the project. So our service users and our carers were at the heart of everything we did. It really was true co-production. So in good QI standards, we had a driver diagram. So we set out to reduce the number of people subject to delay in their discharge by 50%. That meant that our primary drivers were our patients, our carers, access to treatment, placements, leadership, and our communication. And you can see there what our secondary drivers were and our change ideas. Our change ideas based on creating new systems, processes in AMIC and in community to make this happen, to set up a step-down unit. So I'm going to take you through it. So our aim. So back to the why again, to remove the obstacles to patients' return to community. As we all know, if someone's fit for discharge, they should be discharged because that's the best thing. People don't live in inpatient facilities, they live in community. So the aim was to reduce the number, again, by 50%, as I've told you. And that meant that we had to look at our inpatient facility, our community, and beyond. Our outcome measures were the number of patients who were subject to delayed discharge in AMIC per month, the total number of patients discharged from AMIC per month, and our patients admitted out of trust. So how did we do it? Now you're not going to be able to read this because it's a bit small, so I'm sorry about that, but it would have taken quite a few more pages to put it up big enough. So we created pathways we had 27 reasons why someone may be delayed in their discharge. And out of those 27, we grouped them into 4 categories and created a pathway for each one. And then we created an aide-memoire for each one, because it is not person dependent. So no matter who's leading on this, they should be able to do it. So therefore they had an aide-memoire, which was a reminder of what do you need to do to make sure that the person goes through the pathway as they should and are discharged when they're fit to be discharged. So this beautiful picture is of our team, or some of our team with a larger team. So we took this of our team, and then this is Woodstock Bank. We set up Woodstock Bank. It's an 8-bedded, 8 flats, turnkey apartments, high standard in East Belfast that we use as a step-down facility. And we set that up during COVID as part of this project. That was meant to be a temporary measure, but it worked so well that we applied for substantive funding. And we were successful in that bid. So that's now permanent, which is brilliant. And we won an award for that too, about the best COVID story, housing story. So we're really proud of that. And we're really proud of our team. Now, I'm going to hand over to my colleague, Niall Corrigan, who's a doctor in AMAC, to take you through the outcome measures and the balancing measures and all that wonderful QI stuff.
Thank you, Mary. So as Mary explained, my name's Dr. Niall Corrigan. I'm a consultant psychiatrist in the Belfast Trust, and I'm going to talk you through the rest of our presentation. So as Mary alluded to there, based on our number of change ideas, we were able to gather some data to ascertain whether we were able to meet our aim and whether the project was a success. And this is the first run chart which I'm going to talk you through, which is looking at the number of delayed patients. And you can see on the left hand side there's a dashed red line, which was our median pre the NEMO project, and then you can see on the dashed green line our post median, and you can see the number of annotations there which talk about different aspects of the project, and you can see how through the NEMO process, through the opening of Woodstock Bank, we were able to achieve a 67% reduction in the number of patients delayed post NEMO, and that was even despite the fact we were doing this during COVID, and COVID put pressures on the ward in relation to certain outbreaks and certain wards being closed for times. Moving on to the number of total discharges, and this is really important to focus on because I think through the NEMO project we've been able to improve flow, and I think that flow, the increase in flow, has been sustainable. We achieved a 34% increase in the number of patients achieving discharge post NEMO, and again you can see the various factors that were influencing that data and how our change ideas positively impact on the data. But really, data is of itself really important, but really what we're trying to do at our core again was our service users, the why. And this run chart is something that I am really passionate about. It was really the run chart which was looking at the number of patients who were being admitted and treated out of trust. And that was the real problem with our the deficits in our flow before NEMO, and that patients were being admitted out of trust. We know that when patients move out of trust, it's difficult for family members. They have longer admission processes, and really it takes them away from the core of their community, which is where they should be treated. And we were able to achieve a 65% reduction in the number of patients being treated out of trust. And again, that was despite the impact of COVID, which again sometimes had influences on the data. But that's something that we were all extremely proud of. Our balancing measure was looking at service user and staff questionnaire on the NEMO project, whether both service users and staff felt the project was valuable and it impacted positively upon the service users' recovery. So we undertook this in November 2020, and we got 48 responses in all from 8 service users and 40 staff members. And you can see that 94% of our inpatient staff felt that NEMO was a positive experience and it was an effective use of their time. Similarly, for our community staff who again were involved in our NEMO project, they also felt that it was really important and it improved communication between our inpatient services and community services. And you can see on the top pie chart some of the things that were referenced as being a positive benefit of the NEMO process. Additionally, looking at our step-down service, Woodstock Bank, all of the service users who were involved in this and all of the staff were unanimous that Woodstock Bank had a positive impact on their mental health recovery, and they felt supported by the staff working there. And you can see the certain benefits that the the patients felt about Woodstock Bank, which is independence and increasing support. Looking at our system changes, so I think this project has been transformative for our inpatient service. Really, we understood that the co-production ethos was central to what we did, and that putting the service user at the center of what we did allowed everything else to flow from that. Using the QI perspective and using the driver diagram to understand our drivers and help with change ideas was really beneficial. It really was about integrating care across boundaries. Not only where it was inpatient and community services, we also involved our community and voluntary sector to help support Woodstock Bank, and then the Northern Ireland Housing Executive were also involved in that step-down service. And really one of the core things we learned is that an inpatient service has to reach out.
Thank you, Niall, for telling us about the system changes. I'm now going to talk about our future steps. So, the project is about sustainability and ensuring sustainability in patient flow. So we want to make sure this continues, and it has continued. One wonderful thing is the HSCB, the board, have adopted the AMIC model and created 5 bed capacity network coordinators across the region. So they've taken on our model as a model for the region. That we're really proud of. To further improve interfaces with community services, to make sure that transition back into community is seamless. And Woodstock Bank, as I said, has secured substantive funding from the Northern Ireland Housing Executive. So it's a permanent feature now, and it's great. So just the end. We've taken a pride in what we do. We're really proud of this project. We're proud of the work we've done. And the big thing is we did it to improve services for our service users and carers. That's what we're most proud of. Staff were energised by doing the HSCQI award, which is a reward for all the hard work and effort. They really are proud of this and glad to receive this award. And they really enjoyed doing this QI project.
Thanks everyone. I'm delighted to present on behalf of the Belfast Trust.
Thank you very much for listening and enjoy the rest of the event.
So Niall and Mary, I'm absolutely delighted to present you with the Integrating Care Across Boundaries Award. Very well done.
Thank you very much. It means a great deal to us to receive this award today, and I just want to thank the team that have been involved in this. It's been a really good improvement for inpatients, for our service users and carers, and we've managed to sustain the improvement, which is even better. So thank you.